Looks like we have a pretty good group going. So good morning, everyone. Welcome. Why don't we get going? It's 9:02. Welcome to our MOTS EDI webinar, March 6, 2024. As you can see on the display on the sheet here, this event will be recorded. So if you have any concerns about this, please contact the webinar host. It's one of the rules that we do. But they're also the reason we do this. If you get called away halfway the webinar, then you can always find it on our website and review the part that you missed or the parts that you missed later, or you can pass it on to maybe any of the coworkers that couldn't make it today, and they will be able to find it and view the webinar as we have recorded it. So welcome everyone. Go ahead, Kayla. Let's take a look at the agenda for today. Wow, 14. It looks like the list is getting bigger and bigger. Okay, welcome. My name is Piet Vermeer, and I'm glad to be your host again for today. And we'll be talking about the team, the purpose, and information changes, troubleshooting. Of course, we're going to talk about roads because that is the elephant in the room, and there's different things about roads. MFA, multi-factor authentication, also very important and becoming more and more prominent in our life and work. And the webinars, the YubiKey is a part of the MFA. Intro to MOTS, we still do that because it is still up and running and the new system isn't there. Switching from EDI or from one EDI to another EHR or EMR. And of course, we always end with some Q&A and a little list of our contact information. For those of you who have questions or would like to contact us with anything that we might have missed or wasn't clear enough. I also would like to let you know that if you have any questions, issues, you can just put it in the chat or maybe raise a hand and we can bring it to the floor. And if you put it in the chat, we might be able to answer it there and maybe show it to everybody and discuss it with some of my coworkers. So let's go ahead and show the team. Go ahead, Kayla. Of course, we'll start with Kayla, who is our MOTS system administrator and the roads product owner. Blah. Probably need some more coffee. Cecilia, MOTS support specialist. Pete Vermeer, that's me. Mary is also the support specialist. And of course, Jody, you all know her because she is our EDI technical expert and main contact for any of your EDI issues that you might have. And also roads product co-owner together with Kayla. Justin is our MOTS roads report specialist and research analyst. If there's anything about data that you currently have in the MOTS that you want to know more about or have anything that you want to have a review or an overview of, you can always turn to Justin or Anna. She is also learning more and more about the report specialist.
I was gonna check about
Thank you. And Anna is learning from Justin and becoming a specialist herself. And she can also be approached for analysis of the data or information that we have in our systems. And of course, Kelly, still the newbie on the team here, is our roads communications analyst. So that is a little overview of everybody who's here. And the next one is purpose. Why do we do this? Well, you probably are all familiar with why we do this, but it's always nice to give a little overview. So any information on changes and enhancements, because we all like to be kept in the loop on what is happening and how things are happening, and you might have missed something. And it's always very, of course, important to be aware of things that will be changing in the future. So you can, with yourself and your organization and all your business processes, to be aware and prepare for any changes coming. So one of the main things we love to do is discuss data issues. If there are any issues, if there's information that seems to be going a certain direction that we don't really understand or we are surprised, that sometimes happens, although trends and analysis take slow progress usually, but we like to discuss it here to just a reminder for everybody or to talk about things that maybe within your organization you can discuss it again. So any feedback that you might have is always welcome, and we think this is a great platform to receive it from you. And part of that feedback could be an idea for a future webinar topic, and we can put it on the agenda and talk about it and prepare and maybe hear any of your questions that we might have or that might have popped up over time. So thank you. Kayla, next slide. There we go. And this was going to be discussed by, sorry, I missed the name on the agenda for this one, Kayla.
That was Mary.
That was Mary. Okay. And I'm giving the microphone to Mary Hurley. Go ahead, Mary.
Okay, thank you, Pete. So we'd like to make sure that your information in MOTS is up to date. If your name has changed, you have you have gotten married, and we have your contact information under your old name. We'd like to know what your new name is so that we can update that information. Also, if you're a user in MOTS and you have a P number, that P number was set up under your old name and now it's changed. For example, you were once, when you asked for a P number, you were Jane Smith, and now you are Jane Jones. We'd like to know that because it's important, especially when we transition over to roads, that we have the correct name in the system, not only in MOTS, but also in the DHS OHA system, because the P numbers are issued not by MOTS, it's issued by the state agency. And so it's important that they have your correct name in the system as well as your current email address. Um, so just a little FYI, and I'll hand it back to Pete.
Thanks, Mary. Yes, and with the upcoming changes and the new system, it's very important that we have the correct information. So, and if you're not sure how your information currently is in our system, because you might haven't thought about it or checked it for a while, so you can always check with us, and we can give you with the P number what name and information it is we have, and make sure it's up to date. So that would be great. Okay, then next one, Jody, of course, EDI troubleshooting. Trouble in EDI? Nah, that hardly happens.
Never,
Never.
never.
Thank you. Go ahead, Jody.
Yeah. So we wanted to kind of just touch base on this topic again. I know we've gone over it before in the past, but we have had a lot of new folks that are uh, gotten the opportunity, I want to call it, to be the MOTS specialist, soon to be road specialist for your organization. And there's been questions that have been coming in, about different things that are going on. And one of the really most important things, I think, that you really need to do beyond just submitting the file is looking at the results file. Because sometimes when you look at the results file, you may have to actually look into the file. You might have to locate like that submission and find the field where that information should have been sent, and double check if it's accurate, because sometimes there may or may not have been, something that got mapped correctly to the values that we're looking for. Maybe there's just something that needs to be fixed, and maybe it's maybe it's a diagnosis code or something we don't have in the system for MOTS that we need to add. So we always recommend to double check the file just to see if what you're submitting to us is actually what you are expecting to have come. If you are not familiar with looking at that actual file, or the layout, because sometimes it can look a little cryptic, right? It's a bunch of asterisks and values, names, words, all kinds of stuff, dates, numbers. we're always happy to set up a time to go over this with you and look at that. I was just telling a provider earlier today. It's like I really enjoy the provider connection time, and Rhodes is really kind of taken a lot of real estate on our calendars. But I love carving out time to go over this with you folks and stuff. So feel free to reach out. Also, as you know, some of the EHR systems send files automatically, and you might never ever see these files. So when you contact us and you're like, hey, I got this error that came back into our system, um, you're not sure what's going on. When you get a hold of us, we can do a little deep dive into our archive and actually try to pull that file. And sometimes it'll take a little back and forth to actually make sure we got the right one, but we definitely can do some investigation there. And sometimes if things are off, or what's coming through to us isn't what you're expecting, or like I said, maybe something was mapped, maybe it's just the value that doesn't get used very often in a field, but yet now it is. We'll just get with your EHR, have a quick conversation, and just figure out kind of where that's at, and maybe what needs to be done to get a good fix in that. And along with this topic here of maybe needing to look into your files themselves, is super important to be looking at your results files that come back the next day after you've submitted to MOTS. This is what tells you what's been good, was accepted, what wasn't. And if your system has an automation where it brings it in and presents it to you in an area, make sure you're double checking those. Because sometimes when the errors aren't addressed, and if you're unaware of them, then that can cause some cascading effects on additional submissions when you're trying to get further things brought in for the client. So it sounds a little tricky, but once you kind of get the flow and we understand which system and process you're using, we can offer some helpful tips to hopefully make your journey a lot nicer. With that, I'm going to pause. If there's anything in the chat regarding this, let me know. Otherwise, I will give it back.
Thanks, Jody. I did not see anything about that. I saw a question about information, and as I mentioned, you just send an email to MOD support, and we'll get the details of MOD support later. If you have questions about how your information is in there, in our system currently, because it's been over 10 years since MODS has been around. So if you were one of the early entries in our system with a P number, then it might have changed, because I know our organization changes email domain sometimes. It used to be .state.or, and now it's Oregon.gov. So it's those things keep changing. So yeah, just send it to mod support. Okay, roads go live delayed. Yes, the sad word is out, I'm afraid. Kayla, that's you.
Thanks, Pete. Hello, everyone. I am here to deliver the news that Roads Go Live is going to be delayed until the summer. We had a late April go live date, but we just weren't going to hit it. And so in order to make sure the system is functioning appropriately and going to be the system that you all want to see and use, it was decided that it would be delayed until the summer. So that means that training will likely be May or June. But on the plus side, it does give folks more time to get their MFA configured, because in order to do roads training in early summer or late spring, late May is still spring, so May and June, you will need that MFA configured. So we have a number of webinars that we're going to mention later on in this presentation about different ways to configure, and then we'll have a plethora of options for you to get instructions on how to do that. And it looks like we got a hand up. Yes, Susie, do you have a question?
I do, and I'm not able to use the chat feature, which I was just going to put it in there, so my apologies. My question is where are we with CareLogic getting on board with roads?
You want me to take that, Kayla?
Yes, you will know much more than I will about that question.
Yeah.
Thank you.
So Susie, and the rest of you all, CareLogic, specifically has been engaged, with us. Qualifax as a whole has, at the moment, has assigned Paulina with the credible side and Jessica Coleman with the CareLogic side to be the liaisons with us. Now, they have been proactively reaching out to us. We've been having a monthly connect to let them know where we're at. To be real transparent, all the EHRs right now are waiting on us. They're waiting on the EDI documentation that is going to be coming out for what we're calling Roads V2, version 2. And once those documents get out, we do know that they have expressed that they'll be consuming that information internally and then doing some analysis and then working with their providers, but like they need to figure out how to scope it and see what the differences are, because they haven't seen anything from us other than what we've told them. And we have told them that MOTS legacy files, what we call V1 now for roads, will be ingested into the road system at go live. So when we're talking about go live in summer of 2024, potentially, we are, what that means for the EDI users is that your MODS Legacy 1 files that you're submitting today, you're going to continue doing into your SFTP. And there will be a pause from MOTS to roads where we have to bring MOTS down to get a full extraction of MOTS to bring over the data migration into roads, because all your data is moving into the new system. But all the files that you've submitted will stay in a holding pattern for that time period, and then roads will pick them up and start utilizing them. So really for go live, we still want you to get trained because there is some new EDI stuff, but that'll be available to you, but it's not a necessity on day one for EDI folks, because you will be putting in legacy files. So we also understand that once those documents are released, which hopefully will be in the next month or two, that there will be some development and spool up time for all of the EHRs. So, and what that means is it could be 3 months, 6 months, even 12 months. So we've been encouraging those that have been reaching out to us, which also for everybody on the call here. Ocean Epic has been reaching out to us very actively. Dr. Cloud, Reliatrax, again, Credible, CareLogic. They have the really the bulk of the provider set for the EDI. They've got probably 60 or 70% of you all. So Susie, that's kind of where it's at. Part of it is they're waiting on us.
Thank you.
Yeah, I hope that reassures some of you, because I know when we hear go live, right, we're like, whoo, what do I have to do to be ready? Like, is my system going to be ready? So we've tried to build in where that the legacy files will be continuing to come in through roads, and you'll also get your results file in your outbound folder. So that's going to continue. And we do have some super cool things though on the portal. The EDI providers are now going to be able to, you're going to actually have some vision into what's happening. You're going to be able to see your clients. You're going to be able to see what's been accepted. You're actually going to have kind of an area where you can do more checking on your files and analyzation if you choose to there. We've got some super cool dashboards that are also being done, that are like, they update, they got some, beyond pretty colors, right? They've got some great information on them. There's also going to be some ways for you to do some, um, I'm not going to call it self-service reporting, but there's some ways that you're going to be able to do some exports of certain things so that you have a few more tools at your fingertips. So with that, I'm going to pause and not hijack the whole webinar. Sorry, Kayla. So anyways, I hope that helped. I saw some hand claps, so that's good.
Thank you, both of you.
You're welcome.
Jody, this is the EDI webinar, so if you need to hijack it for any reason, you have our full permission.
No, I didn't mean to, but Kayla and I and all of our team have been working so hard on this, and we really value the relationships that we've built over time with all of you. And so it definitely has been a little bit of a struggle when we have to kind of move the goalpost a little bit further, and things are taking longer because we are really trying as hard as we can, and we really value the relationship we've built with all of you.
Excellent. Thank you, Jody and Kayla. And I saw Mary put the MOTS support email full address in the chat. So for those of you who have any questions about their information in the system, it is out there in the chat. So hopefully you can get that. And otherwise, we'll show it later on one of the slides. So, okay. You are familiar with the MOTS Messenger. That's been going out for a long time. But now we have Kelly with the Roads Navigator. Go ahead, Kelly.
Yes. Hi. Good morning, everyone. So we have transitioned the MOTS Messenger to the Roads Navigator, and we've sent 2 editions of that out now. You will still be receiving all of your MOTS information, but we'll also be giving you updates to the Roads project. And we're currently working on the March edition, so be on the lookout for that this month. And if you are not receiving the Navigator, please reach out to us and we'll get you signed up. And it's a great way to keep up to date on everything and in the loop.
Excellent. Thank you. Yeah. And if you have information you'd like to share with your other organizations in Oregon that are working with behavioral health treatment, it might be a good platform for asking for specials that we might want to bring out. So also has to do with feedback. So, okay, great. MFA, multi-factor authentication. Kayla, back to you again.
Thanks, Pete. I'm sure I'm going to sound like a broken record eventually when I say this slide, but because it is something that is going to be needed to access the Roads portal, I will have to repeat it monthly until Roads launches to make sure that everybody is hearing it. Multi-factor authentication is just a way to confirm your identity when you log into various systems. So I'm sure folks are familiar with it, maybe for your banking apps or different apps that you use will often send you a code or have you verify via Duo Mobile, or there's a couple other ones that are like, I am who I say I am, and this confirms that. So that's what the entire state has right now through Microsoft. And because Roads is going to be under this cloud, everyone who accesses Roads will also have to be configured through the Microsoft Authenticator. There are 2 ways to do that. The easiest way, and the way that I think would be easiest for most folks, is by using an app on your cell phone, the Microsoft Authenticator app. And during our MFA webinars, we walk folks through. So I know there's a number of folks who've showed up to previous webinars that have got through and we're able to configure MFA. For folks that are not able to use a cell phone for whatever reason, we will have a physical token called a YubiKey that accomplishes the same thing. It is a little more cumbersome to use and doesn't give you as much flexibility as to where you can log into the system, like what workstation or computer. But we also will be having a webinar to discuss the YubiKey as a whole, if that's something that you think that your organization is going to need to use. And I think Kelly will speak to that in a second. So multi-factor authentication, if you are an EDI provider, Jody mentioned that you'll be submitting V1 files. So you'll be submitting MOTS files into Roads for a while until the EHRs are able to configure to the new specs. But if for any reason you want to get into the portal when Roads launches, to click around and see the different things that you're going to be able to do, you are more than welcome to sign up for multi-factor authentication. The only caveat would be that you will need a P number. So I know that some EDI folks have not needed a P number to get into MOTS. And if you do need a P number, you will need a P number to get into roads. And if you are interested in logging into roads to see what types of information is available to you using the data that you've submitted to roads, we can set you up with that with a user request form. So I will make sure to put the user request form link in the chat so that we can get that process started for you. And I can hand the microphone back over to Pete.
Thank you, Kayla. And then I can quickly, to continue about this information, hand the microphone to Kelly.
Hi. Yes. So we have an upcoming MFA webinar on March 27th. And as Kayla was mentioning, the road system will require MFA, and we're here to support you in getting that set up. This particular webinar is for those who will be using their phone to configure MFA. And so we'll be downloading an app and getting it to communicate with your computer, and we will help you step by step. We also have a PDF of these steps on our website. And so if you feel like attempting this on your own, that's awesome. I will put a link to that in the chat, but just reach out if you have any questions, and hopefully we'll see you there on the 27th.
Excellent. Thank you, Kelly. And the link is already in the chat. There you go.
Oh, Kayla, you're
so
on
efficient. Dang.
Beat me to it.
Yeah, and the phone. It's. I like the comparison to yeah. Whenever you have your bank website and you log in, you get a text to confirm that you're really you. That's basically what it is. And the nice term is multi-factor authentication. So yeah. Okay, let's go with the next item, and that is the intro to MOTS. Mary, go ahead.
I'm going to jump in here,
Oh,
Pete, because we actually added one, our YubiKey informational session. So I mentioned it briefly.
Sorry.
That's okay. I just put the link in the chat for the YubiKey informational session, and I just want to be clear that we will not be configuring MFA in this webinar, mainly because you probably don't have a YubiKey yet. So that'd be very hard to do if we don't have the tools that we need to do that. This is really to ensure that the YubiKey is the right option for you and your organization, or is ready to support that method of authentication, because it does require a bit more. It requires more of whoever decides to use a YubiKey, because it is a physical thing, and you are not going to be able to log into roads if for some reason you misplace it or lose it, or you left it at home, or you left it at the office and you need to, you're working remotely or whatever, what have you. So we will talk more about the YubiKey and how that process will work on March 12th. So that's next Tuesday. If that is of interest to you, or you think that might be the way that your organization will be using multi-factor authentication, feel free to register, and we will see you there.
Thank you, Kayla. Sorry about that. Yeah, the YubiKey is connected kind of like connected to a specific workstation as well. So that is the less flexibility. Okay, now we get to the intro to MOTS. Go ahead, Mary.
Okay, thank you, Pete. So we decided to have, we've been having these introduction to MOTS for a year now, and they occur every second Wednesday of the month. And if you're new to MOTS, or you just need a refresher, or you have new people who need to know the system, this is a great opportunity to have just a bird's eye view of MOTS and how it works, and how to put the information. We do a live demo of putting in a client into the MOTS client entry. I know that this is EDI, but it's helpful if you have a visualization of the information that we're asking in MOTS, and how uh, uh, the information affects others. For example, if you have, we ask for a source of income. If you put none, and then we expect like the estimated monthly income is 0. Um, so it shows in a little sense, if you put stuff into a field, how it affects other fields, and maybe that will give you a better understanding of the information that uh, we're asking for MOTS, and what goes into the system when you send your files. And so we just have a registration for this next week on March the 13th, and we'd be glad to have you join us. So back to you, Pete.
Thank you, Mary. Yes, and those built-in edits are there to help you, and hopefully they improve the quality of the data, because that's one of the things that's near and dear to our heart, to get the best quality of information that we can get. So thanks, Mary. And then next to is Jody, switching from CE to EDI. And I saw the link to the intro to MOTS also in the chat, FYI. Go ahead, Jody.
Okay, super. Yeah, and this slide is really, you may not be CE, but you might already be EDI, and now you're switching from one EHR to another, which still falls into this category because it definitely is a body of work. There's a few less steps than if you were going from client entry to EDI, but we know a lot of you are having some movement in your what you're using. So please continue to, number one, notify us. Let us know that something is possibly on the horizon. It may just be rumblings amongst your organization, or it may be like you've actually gone out, maybe you've awarded and you're ready to fast track something. So let us know. We want to get the right resources and allocation and everything ready for you. If you're in the process of looking at different systems or considering switching, one of the things that we've gotten from, or a multitude of things here that we've gotten from other folks who've gone through this process, is they've found that it's very helpful to really understand the functionality of MOTS/roads in the EHRs that you're looking at. You know, what's the actual process for this functionality? How does it work from the time your client walks in the door to the time the system or someone does a submission to MOTS? How much time, staff time will be required? Who's going to do what? You know, there's no one way that's better than another. If you're already EDI, you probably got a little bit of an idea of like, we know kind of what we're doing today. So you may already be on the track of knowing what you want to ask about, instead of, just being like, yeah, it's got MOTS functionality. Well, that could mean a few different things, and that just helps you and your organization be geared up and ready to get that piece of your project underway when it happens during your implementation. Project timing is just overall important. We want to help you meet the milestones and goalposts that you've set for your project. If you are changing from client entry to EDI, there is a process for switching the data submission method, which we work in tandem with to help get that accomplished. If you are going from CE to EDI, we're going to set up the secure file transfer protocol. SFTP is an acronym we use a lot. That's where you drop your files and do things with, to have MOTS or roads pick them up and take a look-see at them and ingest them or do whatever they're going to do, right? If you're already EDI, you're going to use the same one. This is the case for going from MOTS to roads. Your SFTP directories are also going to be the exact same ones that roads will be using and picking up with. So once you get an SFTP, it's unique to you and your organization, regardless of, in this case, which EHR. But luckily for us, also for roads, from MOTS to roads. So client ID considerations, those are something when you change EHRs, or if you're going from CE to that, those may be changing. Sometimes those are unique to the EHR, a different way they concatenate and do different things to make those unique. So we want to talk about that because we're going to need to shore those up, like make changes to update them if that's necessary. Also, this is kind of internal to you all, but defining your business processes. Once you know how the functionality works and how maybe it's different, you can check that, and be like, okay, well, we've got this laid out. We know who's doing what. And then it's also super helpful too. Like if you do have a change in ownership of who's actually doing different aspects of your data to us, when a new person comes on, then they kind of got this already right there at their fingertips. We're going to test the EDI files. So even if you go with and so let's say that you were, going with well, we'll use CareLogic as an example because Susie brought it up. So if you're going to CareLogic, yeah, they have, already providers submitting to us, but you will test and certify the files at your organization's level. And this is super important because we want to make sure that any customization or different things, and I can't see the slides anymore, but it might be me. But the
Kayla's having some technical difficulties,
oh,
but
there we
it's
go.
back there. She's back.
All right.
She had a
So
little crash.
no worries. That's technology for us. Um, so so those files, due to the customizations and all of these things, and that's a lot of times why you may change from one to the other is something. Anyways, we're going to test them. We're going to help you through it. It'll go smoothly, and we're going to go live, and then we're also going to do some follow up as much or as little as you need. Sometimes once you're live and you're actually getting those results files back, or they're coming into your system, you're kind of getting the real life exchange of data. Then you're kind of like, oh, wait, what is this? Or how's that? So we offer some follow-up at whatever cadence that you feel is appropriate. And a lot of folks have told us that those have been very beneficial and helpful for them. I will say, since we're on this, the testing of the files through EDI, when Rhodes comes live and your EHRs are building to the new version 2, there will be some testing. Of course, there'll be some recertification of your version 2. So just be aware of that. I know your EHRs are as well, but there will be a process we go through, and we'll get through it together and make it as successful as possible. So with that, I will turn it back to our MC, and yeah, just reach out if you got any questions.
Excellent. Thank you, Jody. Questions and answers. Are there any questions? And I saw some hands here and there, but they seem to have answered. We seem to have answered all the questions. That's great. If you have any other questions or something that will pop in your head, and it usually happens right after we kind of drop off the presentation, that something pops up. But oh, there's a hand coming up. Patrice, go ahead.
Hi, thanks for this presentation today. So I just recently took over processing MOTS for this organization that I'm working with, and as you mentioned, the representative that was processing MOTS was not checking any of the results files, so it's kind of created a lot of errors coming through on any of the files that I'm submitting. I just recently resubmitted all of the batches, and I got an error that came back that said it was like, we don't recognize the file format is incorrect, must have one header. And I've never seen that error before.
I think Patrice, I think that was passed on to myself via our MOTS support. And I'm going to have to take a look at it because typically those files do come in pretty just standard with CareLogic, right, through the batching process. So let me get back to you on that. I'm going to try and find the original file, and if I don't have the right information, I'll let you know. But yeah, I'm not sure what is up with, I mean, because usually that's like actually part of the structure of the file that's not quite right. And that just seems strange a little bit for CareLogic, unless maybe there was no contents in it. Sometimes there's different errors, like if there's a header in a trailer but no contents in the middle, right? Because maybe there wasn't anything to pull. That can also trigger some of those errors. So let me thank you for reminding me and us, and I will. I've got a note here, and I will get back to you on that.
Okay.
Yeah.
And thank you so much, Jody. Is there also, I just wanted to ask, is there any way for me to gain access to seeing like the specific batches that were processed accurately?
What kind of, can you expand on that a little bit? Like,
yeah, so like if we submitted 17 batches in 2023, is there a way that you can tell me out of those 17 batches which ones were submitted accurately? Because what I'm showing is that the person that put in all of the MOTS before me forgot to remove the .txt, and so none of those went through. However, it looks like maybe 2 of them may have gone through. So I'm trying to determine which ones were received by the state and which ones were not.
oh, okay, gotcha. That's something that we can probably go. It's going to take a little diving into it. I mean, there are some. I mean, Mary, were you going to mention the area to look at the file names and batch numbers?
Oh yeah, she has a. Do you mean like a P number? How does she get the results file? I mean, she can see.
Yeah, so Patrice, you get the results files and stuff from the SFTP. But are you saying you'd like a way just to see which files were submitted during this time and which ones were accepted by MOTS, or which ones failed? Is that what you're wanting to see?
Yeah, I'm trying to see if I can see which ones were accepted.
Okay. Do you
without
have
having to just go through the FileZilla portal and like downloading all of them?
Hey, Jody, this is Justin. I just took a quick look into the report builder. We do have a table that tracks the batch numbers and the facility Medicaid IDs, total records reported, total actual records, and processed status. There's quite a bit of information in here. So if we could get just the facility IDs and a date range in an email to MOTS support, we can pull up those batch numbers and some information about them.
Yay, that's awesome.
I know.
Thank you so much.
Justin to the rescue. Woohoo! Justin and Anna are amazing.
Thank you, Justin. Did you have anything else? No. Okay, that was.
I did actually.
Oh, yeah, because I saw your hand before that. Go ahead.
Pete mentioned earlier on that Anna and I are both kind of report writers for this system, that Anna's been learning how to do that. I want to say that's no longer accurate. She knows how. In fact, she can beat me to it most of the time when a report request comes in. But just to emphasize, if you need your data back out of MOTS, you need to see what's come into us, you need to see what's, maybe you need a summary or a list or whatever it is, let us know. You can send an email, you can fill in a report request on our website. Whatever it is, we'll get that data back out to you as much as we can, as quickly as we can. That's kind of what we're here for. And to emphasize a point that Jody made a little bit earlier, please do try to check those response files. We occasionally get requests that say, this person has been closed since 2019, but they're still on our active client list. Can you guys close them and make them go away? And the answer is yes, we can. We can do that one-off. We can do that in big batches. If your system cannot close that record, and I'm emphasizing, please check those response files, because it seems to me in maybe half of the situations that I've looked at, the reason those old records have not been closed is that we're not getting the closure data. Maybe your system's not sending it. Maybe your system sent it, but an error came back and was never resolved, or the error was resolved, but the new data was never sent, or a variety of other reasons. So again, emphasize to check those response files. And if you still can't close the record, let us know. We'll work with you. We'll try to figure out what's going on, fix it, or close it for you if we have to.
Thank you, Justin. And to get back to Mary's point, in the MOTS system, there is a section where you can look at submitted EDI files and statuses and stuff like that. So there's there's multiple ways to get the information that you might be looking for. Okay. Anything else? I'm not seeing it at the moment. So, okay, thank you all very much.
I have another question. I'm sorry, I don't want to
That's
take
okay.
up everyone's time here, but I think we have a little bit more time since we're okay. There is a error that I receive quite often, and it has something to do with the last name at birth. Our EHR is CareLogic. And when we go into our system, we can never find the last name at birth that the results file is listing.
Okay.
And we've also checked MMIS.
Okay. So when you get an error like that, it's because the checker for I don't technical.
I can answer this for her if you allow. It's the alternate last name in the demographics. That's where they pull that information, is the alternate last name box.
In CareLogic?
Yes.
Okay, so alternate last name has a history, and they're like the records that I'm working with never have an alternate last name listed in CareLogic.
Okay, that doesn't mean the state doesn't have a different name, because the state gets that information from lots of places.
Right. So how do I find that? Like, how can I verify if my records don't have any information?
On the results file, it's going to tell you what you put in. It's going to say you submitted this client ID with this name, with this last name at birth, and this date of birth. When you get an error like that, it's because it's checked the client ID that you put in, and it's checking the date of birth and the last name at birth. And it'll tell you what we have in MOTS, but you have to look at the record that, is the part of the results file saying this came in. Look at the at the last name at birth and the date of birth, because one of those or both aren't matching. It's going to be on the results file what you submitted into MOTS.
So just to add to that, Patrice, what Mary's saying is when you take a look at those results files, you'll be able to see, do you bring them into Excel, or do you just look at them in their native format?
I bring them into Excel.
Okay, excellent. So the first few columns in there is going to give the information that you put in your file. So it's going to have like their date of birth. It's going to have a column that has the client ID. There's going to be a column that has the last name at birth. And those columns there show what your file had. When you go over to the column where you see the error message, that information in there is going to say this client ID already exists with this information. The information in that error message box is the information that is in MOTS. It's telling you what shows for MOTS. And so usually providers will check that error message like, okay, this is what MOTS has. I go back to these first few columns and this is what my file sent, and kind of where's the difference. Like, is the date of birth off, or is the client last name at birth off?
And generally
Yeah.
speaking, the state is right, generally speaking, unless your staff has accidentally entered the last name incorrectly the first time. Generally, I go with what the state says, unless I know absolutely, like sometimes the very first MOTS will have a last name like Henderson, but the staff has put it in instead of SON at the end, it's Henderson, SUN, or SEN, or some other thing. And you know for sure that it was misspelled because then they changed it, and then the next MOTS errored. And so then I just go in and change the name history back as far as I can to correct it to match what the state says or the correct information. And then you have to unsign and re-sign the MOTS and send it back.
Right. This one is just something that I have come up often, and I can never verify what I'm just the last name at birth. It tells me it's like I can clearly see that it's something else than what I'm showing in my EHR, but I can never find it anywhere outside of my EHR or MMIS. And so I just am wondering if there's a better way for me to go about looking that information up.
If you have a question of what's right, I mean, we can look and see, clients go to more than one place. So, we have to, but the person ID, which is the last name at birth and the date of birth, that has to be true for the client across everything. So you may have a client in your facility, but there might be other records that affect the person ID. So it hopefully Rhodes will eliminate this confusion, this going back and forth. So
Hopefully, yeah. Thank you, Mary. Yeah, no, there's always going to be exceptions to the general rules, and thank you, Susie, for helping us out. Have you any other questions? Because we're kind of running out of time, and I'd like to be on time as much as I can. Yeah, if an individual has run through a program at a different facility and the last name at birth was misspelled there or slightly typed in incorrectly or something, then those things could be difficult for you to find in your system. So that's why I always recommend everybody just shoot an email to MOTS support, and we can do a deep dive and get back into the history and then communicate with you to figure out what the issue might have been, or because there are changes we can make if necessary. And then, but then instead of going back and forth with you and another provider, because no, I have this as last name, no, I have this as last name, then we can kind of communicate it to the multiple providers and say, hey, we have this issue here. Which one are we going to stick with? Because we're going to have to pick one, because otherwise you'll be running into errors like that. So. Okay, I hope that
We
clears
often
everything.
call the client and ask.
We don't. Yes. And especially mention that they might have given, or somebody else might have typed in the information wrong somewhere. So that's an excellent idea. Thank you. Okay, next EDI webinar, April 3rd. Signups are available on our site. The MOTS Messenger or Roads Navigator is out there. And
that is not correct. The next webinar will be April 3rd, but it will be CE.
Yes.
That's my mistake. I didn't update that.
That's okay. You did the dates, and that's good. They overlap sometimes. So.
Yeah, but I would say I would still recommend, if you're wanting information and just in general, we will have a lot of good general information as well, and may have some more roads information. So If you want to join us, feel free.
Excellent. Thank you, guys. And last one is our info about the team. Can you put that one out there, Kayla? Or is there still an issue? There we go. Everybody's email with oha.oregon.gov, and of course the important one, MOTS, or roads at odhsoha.oregon.gov, or MOTS support at odhsoha.oregon.gov. Again, thank you all very much for coming, and hopefully have a wonderful rest of your day. Take care. Bye-bye.
Thanks. Bye.